Hi, and welcome to Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am an editor at Psychotherapy Academy. This podcast is a way for us to provide you with practical tools for your clinical work. You're listening to the 9th episode in our series, The Middle Path for Trauma Work, a dialectical behavioral training which reviews and explains a set of tools to help you improve your therapeutic skills for working with the PTSD population. Today's episode explores the crucial topic of managing competing needs and multiple crises in clients with a chronic history of trauma. As we explore the hierarchy of priorities outlined in DBT, Dr. Kirby Reutter guides us through practical strategies to address crises while prioritizing skills training and reinforcement. So let's dive right in and learn how to navigate these complex scenarios effectively. Our faculty member today is Dr. Kirby Reutter. Dr. Reutter is a bilingual clinical psychologist who contracts with the United States Department of Homeland Security to provide treatment services for asylum seekers. He's a TED speaker and the author of the Dialectical Behavior Therapy Skills Workbook for PTSD, Practical Exercises for Overcoming Trauma and Post-Traumatic Stress Disorder. This audio is an extract from our online course, which allows you to earn 9.25 CE credits after completing the concluding multiple choice questions. These credits are valid for psychologists, counselors, social workers, physicians, and nursing professionals. Without further ado, here's Dr. Reutter.
Welcome to the 6th video in this module. As we have learned from previous videos, clients with a chronic history of trauma may be dysregulated across a variety of domains. So what do we do when a client has competing needs or even multiple crises at the same time? Well, that's what we will learn in this video. So let's get started. It's no surprise that many trauma survivors experience multiple crises at the same time. Precisely for that reason, DBT provides a hierarchy of priorities so that clinicians know which issues to prioritize. The first priority is to address any suicidal thoughts or behaviors. It's no surprise that that would be top priority at all times, because if you think about it simply from a practical perspective, it doesn't matter how good of a therapist you are, you cannot do DBT or any other model for that matter to a client that's not alive. And the second priority is to address treatment interfering behaviors and or ruptures to the therapeutic alliance. So what do we mean by a treatment interfering behavior? That might refer to behaviors such as monopolizing a group, or not participating at all in a group, or showing up late to a session, or not showing up at all. Once again, it doesn't matter how good of a therapist you are, you can't provide any sort of treatment if the client doesn't even show up. The third priority is to address quality of life behaviors. This refers to behaviors such as constantly getting evicted, or constantly getting fired, or constantly moving from address to address. Once again, if a client's life is literally that unstable, it's going to be very difficult to participate in a consistent treatment regimen. Now, the fourth and final priority is to actually engage in skills training or reinforcement. If you think about it, the first three priorities all deal with crises, while the final priority deals with skills work. But remember, all of these are priorities, and therefore they all need to be prioritized. Just because a client is having what I call a COW, which stands for Crisis of Week, does not mean we neglect skills work. On the contrary, each COW that happens is an opportunity to practice skills and learn new ones. So if your client has recurring COWs, and trust me, we all have that client sometimes, So every single week, it's either the same crisis or a different crisis, but regardless, it's some kind of a cow. There are several strategies you can implement in order to honor all 4 of these priorities. In other words, deal with the crisis while still teaching skills. Here are some suggestions for doing that. One suggestion is to allocate cow time for either the beginning or end of a session, and then use the rest of the session for either skills work or trauma processing. Another option is to use a diary card or a chain analysis to dissect the cow in more detail. Another option might be to utilize between session support to deal with the cow in real time so that it does not need to monopolize session time. And finally, use the cow itself as an opportunity to practice skills or learn new ones. So let's summarize a few of the key points we have learned in this video. First of all, many trauma survivors experience multiple crises at the same time. DBT provides a hierarchy of priorities so that clinicians know which issues to prioritize when. Priority 1, address any suicidal thoughts or behaviors. Priority 2, address treatment interfering behaviors and or ruptures to the therapeutic alliance. Priority 3, address quality of life behaviors. And finally, priority 4, engage in skills training and reinforcement. Another key point, the first 3 priorities all deal with crises, while the final priority deals with skills work. However, it is important to remember that all 4 priorities need to be prioritized. Just because a client is having a cow crisis of week does not mean we neglect skills work. On the contrary, each cow is an opportunity to practice skills and learn new ones. And finally, if your client has reoccurring cows, every week it's either the same crisis or a different crisis, there are several strategies you can implement so that you honor all 4 priorities. In other words, deal with the crisis while still teaching skills. So here are some suggestions. Allocate cow time for the beginning or end of a session, and then use the rest of the session for either skills work or trauma processing. Or you can use a diary card or chain analysis to dissect the cow in more detail. Or utilize between session support to deal with the cow in real time so it does not need to monopolize session time. And regardless of your strategy, use the cow itself as an opportunity to practice skills work or learn new skills.
Okay, so Dr. Reutter provided valuable insights into the hierarchy of priorities in working with clients experiencing multiple crises simultaneously. We learned that addressing suicidal thoughts or behaviors takes precedence, followed by treatment-interfering behaviors and ruptures to the therapeutic alliance, and then quality of life behaviors. However, it is important to remember that all 4 priorities must be acknowledged to provide comprehensive care. Dr. Reutter also highlighted the significance of using crises as opportunities for skill building, suggesting various strategies such as allocating specific time for crisis discussion, using diary cards or chain analysis, and leveraging between session support. By integrating these approaches, therapists can effectively address crises while continuing to foster skill development and growth. All right, so this was the 9th episode in our series, The Middle Path for Trauma Work, a dialectical behavioral training. If you want to know more, you can enroll in our course, through which you can earn 9.25 CE credits on completion. If you're a psychologist, counselor, social worker, physician, or nursing professional, these credits are accepted by your professional board. You can click the link in the show notes to learn more about accreditation and the course. You can also access exclusive content which isn't covered in this podcast. This is an on-demand course, and all modules are available in multiple formats. You can watch videos, listen to audio, and download PDF transcripts. If you enjoyed this podcast, you can help us spread the word by leaving a review on Apple Podcasts and sharing news of it on your social media. We are so grateful for your support. Thank you for listening. This was Dr. Jessica Díaz. See you soon for the next episode. Bye-bye.